We'd like to now take this opportunity to introduce our next speaker. I'd like to introduce you to Dr. James Scholey, who is a nephrologist at the University Health Network here in Toronto at the Toronto General Hospital. And his research work focuses on the progression of chronic kidney disease.
Well, I'd like to thank the organizing committee very much for the invitation to speak to you this morning. When I speak to medical students or residents, and I tell them I always enjoy the opportunity to talk about kidney function and what it means to health, they usually consider that a plea for sympathy. But indeed, it's not a plea for sympathy. It's really trying to educate people about what the kidney does and why we should be aware of what kidney function, what the important role that kidney function plays and how that can affect our health. And so today, I'm going to talk about keeping your kidneys healthy, and in particular, I'm going to give you a primer on kidney health and on keeping your kidneys healthy. Now, I was also instructed, as Dr. Moore was, to provide you with some specific information today, and so this is what I'd like to do. And it reminded me of what Dave said to us earlier. I think when people get given a diagnosis of kidney cancer, cancer certainly resonates in your minds and in the minds of your family, but kidney a little less so, because most people don't know what the role of the kidney is in our day-to-day physiology. So I'm going to try to address the question, what does the kidney do exactly? And then I'm going to talk about EGFR, what it means a little bit, and Dr. Moore was kind enough to give us an introduction to this, and I'll tell you a little bit more about what EGFR means, because I think as you see your physicians and as you are undergoing follow-up, you'll hear this term repeatedly. And then I'll talk a little bit at the end about how you keep your kidneys healthy. Now, when I tend to think of what the kidney does, I tend to think of it as two components. The first is as a filter, and the second is as a processor. And I'll talk a little bit about that filter and processor, and then I'll talk to you a little bit about the systemic consequences of that filtration function and that processor function and how it relates to health. Now, the upper left panel here shows you a picture very similar to what Dr. Moore just showed, which is meant to illustrate, of course, that most of us have two kidneys. And the right kidney is hemisected so that you can see on the lower part of the kidney a little bit more about what its function looks like internally. Now, there's something that's very interesting to note. The kidney is a major recipient of the blood that your heart pumps. In fact, 1/5 of the blood that your heart pumps minute by minute goes to the kidneys, which is remarkable because we don't tend to think of the kidney as a recipient of that much. As a consequence, when you look at the structure of the kidney, you can see that it is very vascular, and I'll come back to that in a moment. Now, the other thing that you have to think about when you think of filtration function is that the kidney actually filters about 150 liters of water a day. Now, if you think about it, the water bottles on your table have 1.5 liters. And that's equivalent to 100 of these bottles a day filtered by your kidney, both kidneys together, which is remarkable. In fact, actually, just in the last hour and a half that we've been sitting here, close to 6 of these bottles have been filtered by those individuals who have two kidneys. So that's a remarkable function. The kidney is exquisitely dependent on the cardiac output, the blood flow that it receives to produce that filtration. Now, one of the ways I think about it too is that when you look at a milk carton in your refrigerator, it has about 1.9 liters. And so every day, if you can imagine, if your fridge doesn't hold 70 milk cartons, but indeed your kidneys filter 70 milk cartons of water a day, and then they process that. And it's pretty remarkable. Now, how does the kidney do this? Well, it does this by looking at, and I'm going to talk about just two specific structures. On the left-hand panel is a light micrograph of a kidney. And then this is taken at very high magnification. And this center round structure here is the filter of the kidney called the glomerulus. This is a tiny collection of blood vessels, and each of us has about 1 million of these structures in each of our kidneys, so that we have a complement of about 2 million of these very small microvascular structures that are responsible for filtering about 150 liters of water a day. Now, that water is filtered from these blood vessels into this space here, which is called Bowman space, but it is the very beginning of the processor. And what is the processor of the kidney? Well, the processor of the kidney is the renal tubule, so that the blood comes into the kidney, goes into the filter, and then from the filter goes into the kidney tubule following these red dots, in which it is processed so that out here comes the urine. So that each of us filters about 70 milk jugs a day, but we only produce about 1 milk jug of urine a day on average. So that indeed, what you see here is 150 liters coming out here, and then you have all of this processing to end up with about 1.5 liters a day. That's a job that's going on right now, so that even though you filtered about 6 of these water jugs since the talks began this morning, you only made a few hundred cc's, if that, of urine, and you don't have to get up and go to the bathroom. Now, what does that processing involve? Well, the first thing that the kidney has to do is it has to think about salt. Now, you and I eat a lot of salt every day. We eat it added to foods, we eat it as a constituent of foods, and on average we eat about 200 millimoles a day, or about 7 grams of salt. If we eat too much salt, we get high blood pressure. If we eat too much salt and get high blood pressure, we get cardiovascular disease. And that cardiovascular disease is associated with heart and stroke problems. So that salt intake is an important determinant. Now, when you and I evolved running around the plains of East Africa, there wasn't a lot of salt in the environment, so the kidneys are very, very good at conserving salt, and also very good at excreting it, but it's a critical role. In the absence of this function, salt accumulation will contribute to high blood pressure. The high blood pressure will contribute to risk of cardiac disease and the risk of stroke. So the kidney becomes one of the important determinants of cardiovascular events, which are the common causes of death in our society, particularly in North America, but believe it or not, even in the developing world. Diseases like cardiovascular disease and diabetes now exceed infectious disease as the commonest cause of death. And what about water? Well, we all drink water. And typically you and I drink about 1.5 to 2 liters a day, tap water or bottled water. And the kidney actually has to determine how much of that water to filter to excrete. And so it does a very good job of that. It filters 150 a day, and in average allows that balance to occur. So salt and water balance are critically dependent upon kidney function. What about another major problem? Well, shown here actually are bananas and orange juice, which are locker-block full of potassium. Potassium is a mineral that is a constituent of our diet, and the kidney plays a key role in actually excreting potassium. If the kidney is unable to excrete potassium, it will accumulate in the blood, and it has an effect on both your skeletal muscle to make you very tired and fatigued, but critically it affects heart function. And potassium accumulating in our blood will tend to make the heart stop, and in fact is a cause of cardiac arrest. So the kidney plays a key role in potassium balance. Now, the kidney also plays a key role in maintaining balance, and you and I eat about 1 to 1.5 grams of protein a day. If we're vegans, we eat considerably less than that. If we're McDonald's gluttons, we eat considerably more than that. One of the consequences of eating protein is to produce nitrogenous wastes. One of the ways we recognize this is by measuring urea in the blood, and to actually have increase a lot of another mineral called phosphate. And the kidney plays a key role in excreting nitrogenous waste and excreting phosphate. So that kidney function plays a key role in salt and water balance, potassium balance, the regulation and excretion of nitrogenous wastes, and a critical role in maintaining phosphate balance, which has a number of effects on individuals. Now, when we think of all of this, one of the things that we have to be concerned of is as kidney function declines, what are the problems that we face? Well, one of them is an increasing difficulty in managing the salt and water load in our diet. That's where dietitians come in and where you're going to hear about after I speak. We have to be concerned about how much water. Now, we were told, of course, that hydration is important, and it is important to your health, but not too much hydration as kidney function declines. We have to think about the protein and phosphate we eat in our diet, and we have to be concerned about potassium. And you'll hear more about this in the talk about how dietitians can help us manage our kidney function's ability to maintain balance as kidney function declines, or indeed as you undergo a nephrectomy so that your renal mass is reduced. Now, all of these effects that we don't think about every day, the fact that 1/5 of the blood flow from the heart goes to the kidney, that we filter 150 liters a day, that we eat 7 grams of protein, that we eat 3 grams of potassium, and that we somehow have to collate all of that information and allow the kidneys to excrete it. What are the systemic effects of that? In other words, as kidney function declines, as it's less able to manage the normal balance in salt and water, potassium, phosphate, and protein and nitrogenous wastes, what happens to this to people? Well, the first thing that happens is that there's this extraordinary relationship between the kidney health and cardiac health. And indeed, the vast majority of patients who have chronic kidney disease don't end up on dialysis. They end up dying of a cardiovascular event. In fact, actually, that unfortunate consequence saves our healthcare system, because if everyone with chronic kidney disease ended up on dialysis, then we wouldn't be able to afford to look after them all. But the individuals with chronic kidney disease face cardiovascular events, very, very critical. Indeed, and surprising for most people, is that the kidney plays a key role in actually bone health. Now, we all know about fractures as we get older and the terrible impact of fractures. The kidney plays a central role in maintaining bone health. And as kidney function declines, so too does your bone health, so too does the mineralization in your bone, and so too does the tendency to be at risk for fractures. Dr. Moore alluded to this in the role of the kidney as a hormone producer. What most people don't realize is that actually the kidney is a major regulator of our blood. It affects anemia, and these small pictures of the corpuscles are the red blood cells. And the kidney is the central regulator of the number of red blood cells that we have in our body. And as kidney function declines, we become anemic. And as we become anemic, we become increasingly fatigued, and that anemia may also contribute to cardiovascular disease. Skeletal health also impacted upon. As kidney function declines, so too does your ability to maintain your normal muscle mass. As we all get older, it becomes more difficult to maintain our skeletal muscle. But as kidney function declines, that ability to maintain muscle mass becomes compromised progressively. And then finally, kidney health has a key role on the health of our blood vessels. Now, I'm not talking necessarily about the blood vessels in the kidney, but the blood vessels to our heart, so coronary heart disease, the blood vessels to our brain, stroke risk, the blood vessels to our peripheral vascular disease and loss of limbs. And this is predominantly related to calcification within these blood vessels. And when the kidney's ability to manage potassium, and particularly calcium and phosphate balance, becomes compromised, calcium ends up being deposited and contributes to peripheral vascular disease. So that the kidney has a number of functions that we're actually extraordinarily dependent upon day to day. The amount of water we drink, the amount of salt we eat. But in the long term, kidney health has a remarkable role in the maintenance of our health in systems that we don't think are related. Heart disease, bone disease, muscle maintenance, and in fact, that blood vessel health. All of these are affected. Now, eGFR, I'm just going to talk about this very, very briefly to say this is an estimated measure of kidney function, the estimated glomerular filtration rate. It tells you how much water your kidneys filter. And it's only important because it's the basis of staging for kidney disease. and I'll go through this very quickly. eGFR is a calculated value, so that each and every one of us in this room should know, we know our age and gender, we need to have our serum creatinine measured. And the serum creatinine defines our eGFR, which is a measure of our filtration rate, that 150 liters per 24 hours. And when this Alan Goh and co-workers actually published this paper 7 years ago, it's a seminal paper in the New England Journal of Medicine, because they looked at the risk of death on the y-axis versus the level of kidney function calculated from the eGFR. And they found this stepwise increase in overall mortality. And that overall mortality based on serum creatinine was associated with cardiovascular death, shown here. As your kidney function declines, as your filtration rate goes down, your risk of death and cardiovascular disease goes up. This is why Dr. Moore and his colleagues are so very concerned about maintaining nephron mass in the setting of cancer disease. And in fact, even the time that you end up in a hospital, shown here in the last panel on the y-axis, is also very dependent on your GFR. So how do you keep your kidneys healthy? Well, there's a lot of work going on in this area, but there's 3 things I think that are critical, and I'll touch briefly on a 4th. The first is that blood pressure is extraordinarily important. Blood pressure really is a function of salt and water balance, and the kidney plays a role in that. And that the maintenance of blood pressure is the most important determinant of kidney health over time. So that everyone should know what their serum creatinine is, and everyone should know what their blood pressure is. And as Dave told us earlier, engaging people in maintenance of their blood pressure and home blood pressure monitoring in anyone in whom kidney function can be compromised is critical. And indeed, a target of blood pressure and home blood pressure monitoring are actually the cornerstones of what the Canadian Hypertension Education Program is all based on. We should know what our serum creatinine is, and we should know what our blood pressure is. And if it's not at the right level, we should make sure it is by having it treated. That will preserve kidney function over time. And as it preserves kidney function, reduce the consequences of impaired kidney function on our global health. Critically, we need to know if we have diabetes. Diabetes is actually the worldwide epidemic of the 21st century. It will very soon leave infectious disease in the developing world in its dust, and in North America it's a major, major problem. We need to know for our kidney health, do we have diabetes? And in fact, everyone should know what their fasting blood sugar is. And we have to be particularly concerned and work with our dietitian colleagues to maintain body weight. This is a problem, of course, that Dave alluded to, because your physicians want you to reduce your body weight, to reduce your risk of diabetes, but other things in health can sometimes impact on that. So it's not an absolute rule, but maintenance of healthy body weight and knowing your fasting blood sugar level, particularly over the age of 40, critical for maintaining kidney health, because not surprisingly, diabetes is a disease of blood vessels, and the kidney is full of blood vessels, and it is a major target for the complications of diabetes. Well, actually, someone earlier in the audience mentioned to me tiny bubbles. And what do tiny bubbles mean? Well, tiny bubbles talk about protein in the urine. And so this is meant to show a vial that contains urine. And this golden elixir is critical, of course, for our health day to day. But indeed, it can provide a window on kidney health. And so everyone who has kidney in their health history needs to know indeed whether there is evidence of protein in their urine, because protein in the urine is a risk factor for progression of kidney disease, or said another way, individuals who have protein in the urine are at greater risk for decline in kidney function over time. And as that kidney function declines over time, they're at risk for all of the health issues that the kidney impacts upon. So knowing that protein excretion rate, and indeed working with physicians to use medicines that can reduce that urinary protein excretion rate, are critical for maintaining kidney health. Now, I won't talk about medications in general because I was focusing more on what the normal kidney does and what maintains normal kidney health, but medications are important, and I always advise all patients who have kidney in their health to be aware of the medications, and if they have any questions, to speak to their physicians about new medications, and particularly analgesics that they might use. So, to keep your kidneys healthy, know your blood pressure. Get tested for diabetes mellitus and check your urine for protein or albumin. These are 3 key things. And much more information is available on the Kidney Foundation of Canada website should you be interested in that. So the goals for today were to remind us of what the kidneys do on a day-to-day, in fact, an hour-by-hour basis. They do a tremendous amount. eGFR. Well, eGFR is a way of calculating the filtration rate, that ability of the kidney to filter blood. It's a calculation that's based on a blood test, and the blood test is serum creatinine. And how do you keep your kidney healthy? You make absolutely certain you know what your blood pressure is and that you monitor it. You make absolutely certain that you know or that you do or do not have diabetes, and if you do, you have it attended to, and you maintain a healthy body weight. And finally, you make sure that you know if you have protein in your urine or not, because that helps to define your risk and to maintain your kidney health. So thanks very much for your attention.
Thank you, Dr. Scholey. That was very informative. And when I lost my kidney, I realized you don't know what you've got till it's gone. And so that's a really helpful talk today in terms of all of our, everybody in the population taking care of their kidneys, but especially those of us who have one.